Just when I thought that doctors could not possibly mess up my life anymore than they already have, just when I thought that my body couldn't really break down in any more ways, the universe surprises me with such slings and arrows of outrageous fortune that I think Hamlet would be impressed. This is the week of my appointment with an orthopedist for my knees. I've been waiting for over a year to see an orthopedist for my anterior medial inner knee pain. It's happening on Friday. Of course, I'm really nervous because every other doctor's appointment in the last year and 3 months for this issue has just, I'm sorry to say, use the word everyone hates, gaslit me. Acted like there couldn't possibly be anything wrong with my knees. And then I had a plica show up on my MRI, and that explains my symptoms perfectly. And I think it's worth investigating after everything I've tried to heal my knees in the last year. I also have a phone visit today with a doctor who is going to do a procedure in early September for me to treat my pudendal neuralgia. It's experimental. Again, I've been waiting for this procedure since last December. So almost a year I've been putting the pieces in motion, changed my insurance plan, jumped through so many hoops to finally try this treatment for my pudendal right side nerve pain, which is the main disability that's like impacted my entire life, given me constant pain and inhibited me from sitting. And between those two things, things were already pretty damn bad. And then underlying that, I've come to understand my lifelong problems are all tied to hypermobility, probably Ehlers-Danlos syndrome given my other symptoms and my medical history. Had localized provoked vestibulodynia since I was probably 15 or earlier. It's hard to say because it's not something I noticed until I tried to put a tampon in for the first time. Anyway, I've had 20 years, my whole adult life, in and out of major problems. And I've actually had periods of years of my life of abledness, of ability. Of course, I was still different from other people in ways that I didn't understand were part of a medical condition because doctors always told me everything was normal and fine, even though they clearly weren't. All that to say that right now, I was very hopeful this summer that things were going to finally get better in two very important ways, that I could get my knee mobility back, so that I could maybe social dance again, which was a huge outlet for me, given that the pudendal neuralgia has prevented me from doing seated activities with my colleagues and peers, which is pretty much my whole life since I am a teacher and entertainer, or I was. And going to my friends' shows and concerts and plays has been off limits. And even just like sitting through most typical social events has been excruciatingly painful. And so I turned to social dancing as something that I could get through on a semi-regular basis to socialize and feel joy. And then, 2 years into that, my knees became horribly painful. So yeah, this month and the next 3 weeks, I was looking forward to maybe making some progress, getting some answers, trying some new things. After a year of like nothing, no real new treatments, nothing really effective. So I tried some treatments in the spring and some other creams and stuff recently that messed up my hormones, that added a lot of estrogen. And in 2013 to 2016, I had horrible migraines. And it was because I was on the high dose estrogen birth control pill. That's contraindicated. If you have migraines, you're not supposed to take the birth control pill, especially a high dose estrogen pill, because there's a lot of evidence showing how both estrogen fluctuations, but also high levels of estrogen, like in pregnancy, a synthetic estrogen that's orally metabolized and goes through the liver and raises sex hormone binding globulin. It does all this stuff, and it can cause gallbladder dysfunction, which happened to me, and it can cause the headaches that I had back then. So I got off that pill in 2016, and a whole bunch of medical conditions got better for me. The migraines really stopped being a problem. I would maybe get one or two a year, always with very specific physiological triggers, like having 4 drinks, which changes my blood pressure and the perfusion rate in my brain, or doing specific physical activities, riding in a really bouncy car without good neck support, causing me to clench all these muscles. It would take a combination usually of like a hormonal fluctuation the week before my period, plus some muscle tension, plus some blood pressure thing, maybe doing too much of a yoga thing where I'm bending my head over my waist. Then I would maybe get 1 or 2 headaches a year that I couldn't stop with my own like kind of treatments, Tylenol, neck massage, and I would take sumatriptan. Sumatriptan, also known as Imitrex. This is a home migraine treatment, and it worked really well. It worked partially well some of the time in the really bad years when I was triggered constantly by the high exogenous estrogen from the pill. It worked very well when I was off that pill, not getting that hormonal trigger and just having other more sporadic triggers. Anyway, this summer around June, mid-June, I started being kind of migraine-y again. There's multiple medications that I was trying that I can link to like the trigger. But then I stopped them. And then in July, it kept happening. And I know one of the times was 4th of July. I had too much to drink. I came home, had the stake in my skull feeling, puked, whole nightmare, took sumatriptan, kind of got better. But for the last month or so, it's just continued. Like I've just constantly been coasting on the edge of this migraine land. Any little thing will push me over into a migraine. And last 2 weeks or more now, I've 18 days. I've had a migraine for the last 18 days straight. I have not been able to break it with sumatriptan combined with Celebrex, Tylenol, Toradol, Flexeril, all kinds of things I have in my stash. I've gotten desperate. I've tried anything and everything. Put my TENS unit here. I've done icing. I made a neck traction device. I've done cupping. You can't really see it, but I went to a professional release. I tried a hyperbaric oxygen chamber. Today I was supposed to try dry needling. More on that. I remembered back in the day, one of the only things I could do to break the migraines when they were being caused by the pill, and I didn't know it, was something called prolotherapy, which I had needles with like sugar water injected around my nerves, and that would actually kill the migraine. And I think part of that is just sort of like the dry needling effect, where the needle goes into your muscle, it causes a twitch response, and the muscle kind of releases. That would be enough to break the migraine. I was looking forward to doing that today. But last week, I finally wrote to my primary care doctors. I asked them for more sumatriptan because I ran out. And they were super nice about giving it to me without like a phone call or a visit. I was so happy. And then I took it 3 times like a week and a half ago. And it didn't kick the migraine. So I wrote to them last Thursday or Friday to let them know that it's really bad. It's like really, really bad. I'm kind of scared. It's been weeks of straight migraine. Nothing I can do could stop it. And I also pointed out that in my labs, it showed that I had 5 times higher estradiol in the early follicular phase than on any of my previous labs over my lifetime. So I already know that I have migraines impacted by high estrogen levels and estrogen fluctuations, and I have evidence this month of having an abnormal estrogen situation. And I said at this point I would like to inquire about novel treatments for migraine like CGRP inhibitors and monoclonal antibodies or neck Botox, since you can't take sumatriptan as many times as I've been taking it. There's something called medication overuse headache that happens if you use sumatriptan more than like 6 times a month. I also just about ran out of my prescription in a week. This is very serious. It's called status migrainosis, when you have a resistant migraine. It will not go away. It's resistant to all your normal treatments. And here's what they wrote back. I feel like they doctor-splained me. Is that a thing, doctor-splaining? Like, yes, after over a decade using sumatriptan, I do know that I should use it within the first 1 to 2 hours of the headache. And I also knew that the other medication I requested, Celebrex, for the horrible menstrual cramps that I got, again, I haven't had horrible menstrual cramps like I had last month in a decade. So there's something up with my hormones. She suggested that I take the medications that I asked for together, as if that's not something I would have thought of. Even though I had just explained to her that I was out of sumatriptan and I can't keep taking sumatriptan, her advice to me was to keep taking sumatriptan. So I wrote back and patient-splained to her that I can't keep taking sumatriptan. I explained that I can't take it at the start of the headache because the headache has been going on for 18 straight days. Explained she was asking me to use the drug at a frequency that exceeds safe use. It can put me at risk of medication overuse headache, but I was already using Celebrex and other treatments that didn't work. And to be clear, I was reaching out in my initial messages to tell them what was happening and ask their advice on what to do next. And I did suggest looking into newer migraine medications that I have not tried yet. Actual FDA-approved, specific to target refractory migraine medications. I was told to keep using the drug that didn't work. Then when I pushed back on that, I got this message telling me to go to the emergency room. They used the excuse that because of, now they're taking me seriously, suddenly they're taking it seriously, I need a neurologic examination immediately, which they say will happen in the emergency room. Even after all that, they made no appointment with me, no referral to neurology, nothing. I had to ask, can you at least schedule an appointment with me for primary care at your earliest convenience so that I don't end up 2 weeks from now or next week trying to still do that. So I got one for mid-September.